Do we at Mingle Health have difficulty obtaining data from smaller practices with limited technological capabilities?
Oh, another great question. Interesting. I'm going to have to answer that one with a definitive yes and no. Um, Now, we've always taken all comers from our inception and from the start of Medicare reporting processes, from small practices with limited technological capabilities through large practices with abundant technical skills and resources. And we've developed workable processes for each variation on that theme. Now, I love the push button simplicity of electronic quality measurement. Although it's never as easy and foolproof as we would like, it's never really push button simple. It's more of a dream than a reality. There's commonly holes in the data leading to an underestimation of performance. Holes always underestimate performance, they never increase. Falsely increased performance. Problems include the lack of structured documentation, the lack of documentation standards, absent elements such as exceptions, data that's held in text instead of as structured data received as a fax or a PDF document in your system and not included in the structured data. Now, small or large, practices on paper or practices on an EHR without access or capability of extracting the data, all those times fall back on chart abstractions. Now, it can be hard to do, especially for the practice. Understanding which patient charts to pull will help with that. Each measure might require an enormous number of chart abstractions. Once abstracted and transmitted to us in a spreadsheet format, it's just as easy, if not easier for us, as it is to process electronically extracted data. It tends to be more accurate. Better performance is typically documented than the typically electronically extracted measures. So even though it is a lot of effort for the practice to generate these abstractions, it does show up as better scores generally in your submissions.